Okay, so let's talk about this situation that came up with one of my clients. During annual enrollment period, I switched him from one Medicare Advantage plan or Part C to another Medicare Advantage plan or Part C. The reason why was because his doctor wasn't going to take it anymore, so we went ahead and switched. Then, from that time to the time it was issued, January 1st, and we're at February 10th now, went to the doctors and they are no longer taking Medicare Advantage plans. So how does that work for him? He doesn't want to switch doctors. So what are our choices to go from here? We talked about it. He doesn't pass underwriting. Remember, we talked about if you're a guaranteed issue when you first get into Medicare, which I did not see him when he was guaranteed issue. He came to me a few years later and he doesn't pass underwriting. So what are the options that we can take? We can, one, find him a new doctor that he doesn't want to do, or if his doctor was going to be taking Medicare Advantage plans, we could just find him a new one because we're in open enrollment or OEP, which runs January 1st to March 31st. But those aren't options for us. So what is the option that we have? After discussion, he's going to go back to original Medicare. Does it give him some financial exposure that's a little on the high side? It does, but after discussion, he understands that and he's willing to take that chance. So can you, and when can you, drop a Medicare Advantage plan, also known as a Part C? You can drop a Medicare Advantage plan and go back to original Medicare, because remember, when you're on a Medicare Advantage plan, it is a plan managed by a private insurance company like Humana, Cigna, WellCare, right? United Healthcare. And you still have to pay for your Medicare Part B as a boy, but you put it on the back burner and you kind of forget about it, right? But in this instance, we are going to drop the Part C or Medicare Advantage plan and go back to original Medicare. And then he'll carry original Medicare, which the premium is taken out of your Social Security. And he'll carry a Part D as in dog prescription drug plan. So how does that work? You have two choices to drop a Medicare Advantage plan and go with an original Medicare, Part A and Part B. So the time period to do that is during annual enrollment period, or AEP, which runs October 15th to December 7th. That's the time of the year where you're aggressively getting mail to switch plans. People are calling you nonstop. But that would be the time. You would call your carrier and you would say, I am going to drop this plan and revert back to original Medicare. But you have to also have a Part D so you don't incur that fine, okay? And the second chance that you have to do that is during the general election or open enrollment period, which is January 1st to March 31st. The difference between general election and open enrollment. General election is for people that miss their initial election period or IEP to get onto Medicare on the first time, their first chance of getting on Part B. The open enrollment or OEP is when you have missed annual enrollment period. I know it's a lot, right? When you've missed annual enrollment period, you have a chance during open enrollment period. It is a one-time move, so you can move from one Medicare Advantage plan to the next, or one prescription drug plan to the next. It can't be prescription drug plan to Medicare Advantage plan or vice versa. All right. So, what do you need to consider when you are thinking about dropping your Medicare Advantage plan and going back to original Medicare? Let's get into some of the costs. Okay, so when you have original Medicare, you actually have costs associated with it. And I'm going to go ahead and put up the breakdown here so you can look at it. But remember, Part A is going to be your hospital insurance. You have costs when you're in the hospital. It's co-insurance. Part B is your medical insurance. It's an 80-20 plan. You have an annual deductible of $257, and it costs you a premium every single month. They either take it out of your Social Security, or it is a easy pay, a bank draft right from your bank account, or a paper bill, which is quarterly. So, is switching over to original Medicare a good choice for you? And I'm not debating whether a Medicare Advantage plan is good or bad. Medicare Advantage plans have a purpose. They are good for certain people, certain situations. I'm not against them, and I'm not for them. In a perfect world, every one of my clients would have original Medicare and a Medicare supplement, but that just doesn't work out for many reasons. Cost, health, maybe whoever helped them get onto Medicare in the first place didn't advise them about Medicare supplements. So that's for another debate at another time. You have to remember that you have co-insurance with original Medicare. You must have a Part D prescription drug plan. And I know when you look it up, it will say voluntary. That's BS. It's not voluntary, because if you don't take it, they will fine you for not having a Medicare prescription drug plan. So I get all the time, well, what if I don't take medication? Get the cheapest one out there. In your area, it goes by zip code. Maybe it's $15, $35. Just get it and don't worry about it. You can take it out of your Social Security, or you can pay for the year. If you are on a lot of drugs, a lot of prescriptions, you need to let your agent put them into the system, or whoever's helping you put them in the system and find the best plan for you. So then your cost will be Medicare Part B premium, your Part D premium, and then 20% every time you go to the doctors with your Part B after you've paid the annual deductible. And then if you're in the hospital, skilled nursing, or home health, you'll have the co-insurance, which I've already put up for you to look at. Now, let's understand that, actually what I want to say is, what if you are on original Medicare and then you decide, you know what, I really do want to get back onto a Medicare Advantage plan or Part C. You can do that, but you need to wait till annual enrollment period, which is October 15th to December 7th, or you need to wait until open enrollment January 1st to March 31st. All right. If you guys have any questions about how to get off of a Medicare Advantage plan and solely go with original Medicare, put them in the comments. Oh, I know what I wanted to tell you. The numbers that I'm putting up and the numbers I'm talking about, your co-insurance, your copay, your co-insurance for Part A, your 20%, and the Part B premium and the deductible change every January 1st. So whatever it is right now, I've already put it in the picture for you. January 1st, 2026, it will change and be something totally different. All right. If you guys have any questions, comments, put them in the comment section. I will answer them. I will not debate whether Medicare Advantage is good or bad. And if there's anything political that gets put in these comments, they will get deleted and you will get blocked. Have a great day.